breast density is a risk factor for breast cancer. What is breast density? Breast density is seen on mammogram. It's how much active breast tissue is still in the breast. As we get older, the normal, dense, active breast tissue, the glands that, will ultimately produce milk, as we get older, those go away. They actually disappear over time, and the breast turn to fat, and the fat are very non-dense. So dense breasts are actually on mammogram, how much actual active breast tissue there is. And the more active breast tissue there is, the higher the risk for breast cancer. But it may be more than just how much is there. It may be that the fact that there's a density about them. They may be more hormonally active or a little bit more growth active. We don't fully understand the biology of why and what's going on with breasts that are dense. But we do know that very dense breasts, not just a medium amount, but very dense breasts are just very difficult to evaluate on mammogram, do increase the risk for breast cancer. Now, that's different than fibrocystic changes, okay? Fibrocystic changes are the normal hormonal changes in the breast, cysts or swollen breasts or harder breasts that come usually under hormonal influence. And when then a woman starts her period, things will soften up again. But some women have chronically breasts that feel kind of nodular. They're just not smooth. They're more nodular. That's not necessarily dense breast tissue on mammogram. So dense breasts are really just about mammogram, but having fibrocystic changes either with and during the periods or just as a baseline does not increase the risk for breast cancer. One thing that's interesting is that when we hit the menopause, if our breast tissue goes from, moderately dense, which is about normal, to fatty replaced, that actually is known to really lower the risk of breast cancer. And one of the things that taking anti-estrogen medicines do, for example, for women who come from very high-risk families and they would like to take 5 years of an anti-estrogen pill, such as tamoxifen or anastrozole, to reduce their risk of breast cancer, those agents, those treatments that lower breast cancer risk, it will lighten up the breast density. It decreases the breast density. Hormone replacement therapy after the menopause increases breast density. And that can make it a little bit more difficult to diagnose breast cancer because the breasts are more dense, but also increases the risk. So hormone replacement therapy does increase the risk if taken for a longer period of time. So dense breasts, yes, these are very modest elevations in risk. However, this is not a substantial elevation in risk, but it's modestly so. And so a woman, it's reasonable to avoid other things that we can control that can increase risk, like alcohol, not drinking alcohol or not drinking more than one a day on average, and avoiding prolonged use of hormonal contraception or hormones after the menopause for many, many years that can also increase the risk of breast cancer.